Welcome to everybody. My own personal welcome to our final round of the HealthTech Innovation Challenge. Welcome to the live audience that's here at Startup Health in San Francisco, as well as to our live stream audience. And we're going to have a panel discussion for a few minutes, which I will affectionately refer to as 5 white guys in suits talking about innovation.
I don't have a suit on.
Oh, you don't have a suit. You got jeans. You're good.
I got green jeans.
It actually just struck me as the fact that we were here looking like this, talking about the topic that it deserved to be called out.
But we probably have plus or minus 4 years of age between us.
Right,
Pretty good breadth of perspective.
So what we're going to address here is really asking the question about big companies looking at startups. Historically, these kind of meetings are driven by investors thinking about investing. But the category that we're really interested in exploring is really when big companies look at startups and young companies, how do they think about them? And that's what the perspective is that you're going to get from the group. So we've got Chris Young, who's the Vice President of Innovation from Accenture, standing right here next to me. And then next to him is Eugene Barukovich, who's the Global Head of Digital Health at Bayer. And then we have Charles-Antoine Jensen, who's Managing Partner of UCB Board and a member of Coase Investment. He may tell you a little bit about what that means relative to his perspective. And then Tom Van Herdijn, who is the President of Diversified Businesses at Blue Cross Blue Shield of Minnesota. So let me start with the first question, and I'm actually going to start a little bit out of order. I think, Charles, I'm going to just start with you, but the question is real simple for all of you. Why do you come to things like this? What are you looking for?
UCB wants to generate great patient value. It can only do so by connecting to the best innovations all along the biopharma cycle, from drug discovery to clinical development to patient engagement. It's impossible for it to do it alone. So we seek to partner with the best innovators all around the world, and to have Accenture, who does the pre-screening, is obviously a great advantage.
Very good. Great. Thanks. Eugene?
Yeah, I just wanted to add to it. So for the startups, it's ABC, always be closing.
Yeah.
I think for a team like mine is always be connecting the dots, right? So ABCD. And I think obviously, Bayer's 100,000 plus employees. It is important to connect to the ecosystem. And the reality is, I said it earlier in the day, that for every challenge that we have out there, there's a brilliant entrepreneur somewhere working on it. Mm. And so the idea is the team is here, we want to connect and ultimately co-create.
Very good. Chris, what brings you here?
Much the same thing. I think the reality is the opportunity here is to spot the next brilliant company that's going to be potentially a unicorn or do something that is just fundamentally disruptive in healthcare. I don't think it's going to come from the existing institutions. I think it's going to come from a couple people in some little incubator someplace. They're not even going to know what they have, and then it's going to blow up big.
Very good. Very good. How about you, Tom?
For us, this is about relationships. Blue Cross of Minnesota is a relatively large blue and really has repurposed itself in the last year or two as a national provider within the health services space. So we're looking for relationships within the early stage community to invest in, to learn from, to share what we know.
Very good. So let's dive a little deeper into this question. The question that is often important and on the minds of young companies and startups is if a big company is looking at me, what are you really looking at me for? Are you looking at me because you're interested in my technology or intellectual property? Is it a business model? Is it something else? So Chris, I'm going to ask you to start from your particular perspective. As you look at these startups, what are you looking for?
Yeah, so there are several lenses which I come at this. The first thing is, does it have some sort of operational benefit that's going to be meaningful to us? And or a clinical benefit? Does it do something that really is going to drive quality in our organizations? Third, does it give us some sort of strategic edge? And that can be with consumerism or some sort of digital consumer engagement, something that really gives our markets a little bit better advantage to make the experience for customers much more attractive and appealing because there's more and more choice that's out there. I think ultimately the other thing, which comes down to it, is are you really solving a problem, or did you just come up with a function? Mm-hmm. Or did you come up with a feature, or do you have a real product? Do you have something that's real, that's thought out, that has the opportunity to basically be put into a healthcare ecosystem and not just something you dreamed up? And have you really thought through how are you going to put that into those ecosystems, whether it be from a payer provider standpoint or from any other standpoint? But will it really work, and have you come at it from a mature lens?
Very good. So, Eugene, from a life sciences company perspective, how do you think about, what are you looking for?
It's actually pretty binary, and a good friend of mine, Millen, said this the other day posted on Facebook, and it just resonated with me. It's you either do things better or do better things. And so with the team, we're actually looking both ways. In a sense, one is to solve existing challenges within the organization, and they're not unique within the life sciences industry. And on the other side is, how do we do better things? How do we co-create with the entrepreneurs? How do we build new things that will actually impact people's lives, going forward? So both sides are important, and specifically, we try to be very transparent within our programs around the challenges. Last year we ran a program called Deal Maker, 30+ challenges, very transparent. Come apply, and we also serve as a gateway to the large organization.
Mm-hmm.
On the technology side, we see that they evolve and change at an exponential rate. And so it's very difficult for us to be able to pick the right technologies. But we also see that a lot of our technologies in research get quite rapidly outdated. So we're looking to optimize our research technologies to make research in drug discovery much more effective. Clinical trials have a huge potential to become more effective through the application of new technologies. And then on patient engagement, we're just scratching the surface. And some entrepreneurs are understanding patients' experiences and managing to link them to various technologies that are going to create huge transformations in the way we will be engaging and the proximity we'll be having with those patients that were not possible before.
Very good. Tom, how about for you, from an empirical perspective?
I'd say the first is mission orientation, candidly. So we're a nonprofit mission-based organization to make a healthy difference in people's lives. That is not our members' lives, to make a healthy difference in people's lives broadly. So we've got to have entrepreneurs that are mission-oriented versus financially oriented. Second is around subject matter expertise. So we have a queue of clinical areas of interest for us, and we are looking for entrepreneurs who are slightly ahead of our thinking or vastly ahead of our thinking in our areas of interest. And the last is just, candidly, quality of talent, because we're a relatively small organization, 4,000 people. We need people who can come on board and lead.
So as I listen to the operating company perspectives in particular, it's pretty clear that you're looking at these investments as enabling the core business as opposed to maybe necessarily getting into some completely different business. Do you think about looking at startups more when you're trying to enable a sustaining innovation, or do you think about it more when you're trying to do something more disruptive? What's your perspective on that, or does it matter? Chris, you nodded. What do you think?
So I think it's both. I think you can do incremental innovation through a lot of things. But I think it's incumbent upon us to really think about what's the job to be done, and we haven't tackled yet. And I think that that's going to come through disruptive innovators. Some are going to be sitting in this room right now. Some were sitting in the room last year, and some aren't even born yet.
Right. Yeah. I thought from just looking at the companies that are going to be represented up here in the pitch, you could say that some of them look like they're pretty straightforward sustaining innovation, meaning they're attempting to solve a current problem better, and some are really just trying to solve a completely new problem. Did you have a
Yeah, I would say in our business, I'll put it in two halves. First is the core health plan side within the state of Minnesota, 3 million members. And we partnered with an early stage pre-Series A company last year called Learn to Live. This is a cognitive behavioral therapy company. They had maybe 10 or 20,000 active members, and 15 months later, I think they're at 800,000 or 900,000 active members. Still pre-Series A. They're about to close. But that's an example where we took risk, meaning early stage innovator who we thought had something very efficacious, but we weren't sure. But as a small health plan, quote unquote, we could take the risk because we believed it to be true. 12 months later, it was proven to be true, and now they're maturing. So that's on the core health plan side. On the innovation side for us, meaning where we're really focused on getting things nationally deployed, we've got a couple teams working on that, one of which is at the very, very tip of the spear. And so that's where, in my last answer around subject matter expertise and mission orientation, et cetera, that's where we want to partner with those companies that may be early in concept, something past a PowerPoint, but that we can help shape their roadmap and maybe get them to market in a way that they couldn't have otherwise with our access to distribution.
Very good. Tom, let me just follow up then. Big companies work with small companies all the time, fits and starts, some successes, some failures.
Yeah.
What is, from your experience, what is typically the hardest part of a big company actually figuring out how to take advantage of the capabilities and technology and know-how in a startup? Is it making the technology plug and play? Is it business models? Is it operating models? What do you see as the big challenges?
I think it's cultural. I actually think there aren't too many impediments, at least with an organization our size. I feel that we're fairly fleet of foot. Where we've seen a little bit of friction in a couple of circumstances. If we're dealing with a pre-Series A firm, and we think that we can bring great access to distribution and some expertise, we're going to want to share in the gain. So whether it's through a performance warrant or some kind of equity share, I'm just putting it out there, we're going to want, if there's going to be a bunch of winners, we're going to want to be one of them. And we've had a couple of surprising scenarios where the entrepreneurs, I've done this, as you and I know, we go back a ways, I've done this many, many, many times, and of late we've seen 1 or 2 points of friction on that with early entrepreneurs who get close to the altar with us, and then they go, oh, we can't give up that equity, even though they have no revenue, no customers. So,
Eugene,
I'm not going to beat around the bush. I think the biggest challenges is politics and culture. I think, the definition of a corporation is to execute on an existing business model the best way possible. And, I always kind of joke around, how many new business model workshops can you have? The P&Ls can't take it in, right? So I think, you need to be clear around what's incremental innovation, what's, evolutionary and transformative, which takes time, and what is disruptive. And place your bets and focus. And I think the easiest things to quote-unquote sell internally are always things with a much shorter ROI that's solving the existing challenges of today, or 12 months or 24 months. So, that's been really I think, and this is not unique to Bayer. I think any large organization, I've been part of a few, it's really comes down to that from my perspective.
I'm interested in Chris's perspective, and then I want to go to Charles because I've got a version of that question for you because you have a very unusual perspective here.
Yeah, I think that large organizations can be extremely complex to navigate, and I think the key thing is smaller companies should be very, very clear about, do they have an executive sponsor that's really able to get through all the hurdles? And there are a lot of hurdles because you're dealing with a small country sometimes. There's legal, there's IT review, there's compliance, there's all kinds of things that can be elongated in larger companies of all types just because that's the way it is. There are ways to get through them faster, but you really need to have a champion that can navigate that for you. If you don't, you can spend a lot of cycles going down a pathway and achieving nothing. And I'm watching many, many people in this room that are on my side of the fence, and then I have a feeling that a lot of people who are entrepreneurs who've already been burned a few times, you gotta be very thoughtful about that.
Yeah. Charles, before we came up here, you and I had an interesting conversation because one of the things you do is social impact investing. And it was interesting to me when you were talking to me about the companies or the entities that put money into it, what they're looking for, and how that connects up to the startup community a little bit. And I think that really is a little telling in some ways about some other ways that people can think about working with young companies. Can you tell us a little bit about that and how you think about that, the startups in terms of some of these other problems that you're dealing with?
Sure. So Kois is an impact investing firm, and so we look at companies that are at an early stage, have a great societal transformation potential and financial returns. And increasingly, we have large multinationals who come and see us and who notice that they're actually generating the majority of their profits from high-income segments, that middle-income and low-income segments are much higher in terms of needs in that specific industrial area. Today, the pool of profits there is much smaller, but it's growing much faster. And so either they want to invest in that area to understand about it, or they want to invest in that area as a first step in order to fertilize that space that hopefully they will contribute to making a more prosperous market for them in the future. And they know that basically they have, multinationals, have the capacity to scale a solution and execute better than anyone, but they know that social entrepreneurs, as well as tech entrepreneurs, often combinations of the two, are much better than them at finding solutions that are an answer to societal needs at the ground level.
Yeah.
And so the match needs to be done, and you're basically organizing that in a way today.
Great, thank you. Eugene.
I just wanted to add, I heard something at one of the conferences that it turns out that things that are good for the society are actually good for profits as well, right? Because it is solving a real issue. And we have a Bayer Foundation, and it's always about the passionate people that run these things. So Timo runs, they just launched the grants for impact.
Thank you for coming to the Startup Health Festival. This is a friendly reminder that the VIP floor will be closing at 6 p.m.
Not just for the society, but for the corporations as well.
Chris, you're a not-for-profit, faith-based organization. It seems like social impact as a concept might resonate too with some of your strategy. How does that play itself out?
Yeah, I think it's on a case-by-case basis, but wherever there is an opportunity where we can actually impact the social good and engage in social justice, of course, as a Catholic-based organization, we're going to want to do that. It's not always clear-cut when you're dealing with something that's an online tool, but at the end of the day, anything that empowers consumers or empowers bottom of the pyramid in terms of anybody and really dealing with the people who are most poor and vulnerable in our society, we're gonna put a good, solid look at it.
Yeah. What about from an insurer's perspective? They're often viewed as being very focused on bottom line. Do you see them also stepping into this?
I certainly do. Within the state of Minnesota, and just a little history, Minnesota was the very first blue plan. So the blues were created out of Minnesota. So the aspect around mission thinking and social impact is at the absolute core of our mission and what we do. So yeah, it's dead center. We measure ourselves. The board, in fact, just gave us leadership team a 10-year goal in the state of Minnesota, which coming from my prior for-profit experience is a bit unique, and that goal is around social impact. So.
Very good. So in our last minute, I'm going to ask you one quick question, and this is in response to the fact that we talk to a lot of people, and they're starting to tell us that they're getting tired of concepts like innovation and startups and challenges, et cetera. So do we have this meeting in 5 years? Do we call it something else? Does it move on and evolve into something else? Does it get adopted in a different way? What's the future of this dialogue? What does it look like? I'll start here with Chris.
So I don't know that we call it innovation anymore. We call it the job to be done. I like that. And I think that at least 50% of this panel should be women at that point.
Yeah.
I'm going to give you that.
I got 2 daughters. And
you might want to work on some diversity.
I'm just going to simply call it got shit done.
The GSD, man.
Yes.
Yeah. Very good. Charles, what do you
The
say?
biopharma industry's business model has been very static for many years. It started to move maybe 5 years ago. There's definitely going to be a need for more than 5 years for it to have come to a new level of stability.
Tom?
So many of you may know how these panels work. They send you questions in advance. You get prepared. This one was not on the list.
Yeah.
So Kaveh whispers this in my ear right before we're walking up here. He's like, what are you going to call this conference in 5 years? So I came up with Spectravation. It's not innovation. It's a new spectrum of innovation.
Yeah.
So I've got Spectravation copyrighted for...
Oh, very good. Very good. Very good.
Yep.
Tom, Charles, Eugene, Chris, thank you for your perspectives. Thank you for your help today. And thank you all. Let's stay for the pitches.